And earlier this week, I sat down with a doctor from UF Health to discuss the importance of getting a good night's rest. He provided us with sleep tips and an update on the latest treatments. Take a look. Well, the amount of sleep a person needs depends on a variety of factors, including age. And while adults require less sleep per night than adolescents or toddlers, they often have the most difficulty getting restful sleep. Joining us to explain is Dr. Scott Ryals, a UF Health sleep medicine physician. Doctor, thanks so much for joining us.
Happy to be here. Thank you.
So how much sleep should we be getting, and what are the consequences if we don't get enough?
So we all have busy lives. We all have work and social pressures that don't leave enough time for sleep. The American Academy of Sleep Medicine recommends at least 7 to 9 hours of sleep for all adults, healthy adults aged 18 to 60 years old. In our society, a lot of people get less than 7 hours of sleep. And of course, getting more than 9 hours of sleep can be appropriate for younger adults or people recovering from illness.
What about some tips for getting more sleep?
As far as tips for more sleep, starting with bedtime, leaving at least 7 hours before their wake time to allow enough time for sleep. Also limiting screen time, which is the bright light that we get from our phones, our tablets, our computers. Bright light from these screens delays our circadian rhythm and pushes our bedtime later and makes it harder to fall asleep. And also sleep disorders such as sleep apnea and insomnia contribute to interrupted sleep and poor quality sleep, and these are common things that I treat in my clinic.
Well, and you mentioned that, but what is obstructive sleep apnea? How's it diagnosed and how's it treated?
So obstructive sleep apnea is characterized by stopping breathing while we're sleeping. This happens because the muscles in our throat relax at night and result in either a closed airway or a narrowed airway that results in a drop in oxygen. Our brain has to wake us back up from sleep for this to open up our airway, and this results in kind of fragmented or interrupted sleep. It's easily diagnosed with a sleep study, and the sleep study can be done either at the sleep lab in our sleep center, and we also have home sleep tests as well.
And what's the treatment? Is it that mask that sometimes people wear? Or?
Yeah, so the most common, effective, and safest treatment is positive airway pressure, more commonly known as CPAP. This is a mask over the nose or the nose and the mouth, and pressure is supplied by a tube that connects to the mask. That pressure just inflates the airway, keeps it open all night, keeps the oxygen in the right place. There have been a lot of advances in masks recently that make them more comfortable and easier to wear.
Interesting. I know my dad has one, but he says it works.
Yes.
Is there anything else that is coming along, any kind of medication or anything?
So in terms of treating, so there are oral appliances that dentists can construct that are worn in the mouth at night. These kind of pull the lower jaw forward and keep the airway open at night. There are also some surgeries for sleep apnea. The most recent advancement is the hypoglossal nerve stimulator. This is a form of pacemaker placed in the chest, and it stimulates the airway open at night without need for a mask. So it's a more advanced surgery. It's just coming out, but it is done by our ENT colleagues here at UF Health.
Wow, very interesting, doctor. Thank you so much for all the information and for the sleep tips. We appreciate it.
Thank you. Happy to be here.